No amount of money is sufficient for spending in healthcare. With 1 billion, though, a fair amount can be achieved. It's not anywhere near as much as the 12 billion for the national programme. But I think importantly, if it's ring-fenced, if it's spent wisely, if it's not used to help with winter crises or shortage of nurses, then I think it will make a significant difference. Absolutely. I mean, as I've already said, the patient needs to be engaged with their own healthcare. Patients have a very strong interest in their care. We witness the patients having more involvement with fitness and with devices that monitoring their own condition. So yeah, I mean, I think the more patients are involved in their care, the better the outcomes will be. It's reasonably significant. There's no reason why it can't be done now. The technology exists. It's just a matter of investment and trusts buying systems that would enable electronic discharge letters to be sent to GP systems, and conversely GP systems being able to import the discharge information into their systems as well. Is it significant? Probably not. So open source is where we have made our source code, that's the original files that have produced the software, available in the public domain. We've published the source code. That means that anybody can download the source code, they can modify it, they can use it for whatever they like. It's also free for them, so there's no license charge for the using of the software. But what it means is that they have greater control over the future of that software. They can implement it themselves if they want to, they can support it themselves if they want to, but we as IMS, we're offering those support services available to the trust should they choose to come to us and use it. So the Interoperability Charter specifies 5 core principles in terms of what us suppliers have signed up to, and what it means is that we will open up our interfaces, we will produce those specifications free of charge. It means that suppliers are working together. It's the supplier's answer to the challenge that Simon Stevens has set out for changing models of care. We want interoperability. We want information to be shared between the different providers of care. And as a group of organisations, there's 70 that have signed up so far, with perhaps another 25 that will be signed up fairly soon. That Interoperability Charter means that this is our commitment to the NHS and improving interoperability between different systems.